Welcome to another episode of We Don't Die. I'm your host, Sandra Champlain, author of the international best-selling book called We Don't Die: A Skeptic's Discovery of Life After Death. And just a reminder, my home base is wedon'tdie.com, where you can always find great things like our free Sunday gathering with medium demonstration included. We offer medium classes, afterlife events, lots of things. If you don't have a copy of my book yet and you would like to read a free PDF copy, you certainly can. At that bottom of the page at wedon'tdie.com, you can enter your name and your email address. It says you get the first few chapters of the book. It's the whole book. That's the secret. I know many people are grieving. Chapter 10 is how to survive grief. I've also got some videos and some other great surprises for you just by entering your name and your email address. That's at the bottom of the page at wedon'tdie.com. Our guest today is Dr. Tom Nehmy, who is an award-winning clinical psychologist whose innovative work has reached more than 50,000 people worldwide. An emerging leading voice in the international IADC community, he combines meticulous research and genuine compassion to help people heal from grief and loss. Through this groundbreaking therapy, his clients find remarkable relief from their sadness, often experiencing extraordinary reconnections with their loved ones who have passed. Dr. Nehmy is now on a mission to bring this healing modality to the world. His newly released book is called Inspired Life, Beautiful Death: Healing Grief, Overcoming Fear of Death, and Living a Spiritual Life. You can find out more about him and his work at his websites, tomnehmy.com, and you can also go to healinggriefwithiadc.com. Dr. Tom Nehmy, my friend, welcome to We Don't Die.
Thank you, Sandra. I've been so looking forward to this, and I've already said I'm a big fan. I've been listening to your show for years, and to now be on your show is very exciting for me. So thank you so much for having me.
It's very exciting to meet too, to finally meet you. We've been emailing for a long time. You've got a terrific story to share. First of all, we're recording this at 7 p.m. my time, and you're on the opposite side of the earth. You want to tell everybody where you are?
So I'm in the Adelaide Hills of South Australia, so it's my mid-morning, and that's where I live and work, and it's a lovely part of the world. So yeah.
Oh, wonderful. I love this. And I'm in Rhode Island on the East Coast, USA, just south of Boston, Massachusetts. So, Tom, I'm going to send it over to you. Talk to us about your past, your history. There's so much. There's so much because I want to talk about all of it. But give us a little backstory as to who you are and maybe original beliefs or not beliefs about the afterlife.
Absolutely. So, Sandra, I was a curious child, and I grew up, had what I would call a reasonably normal kind of childhood. People are very interested in the fact that I'm a triplet. I have two brothers the same age. So people find that a little bit unusual, but it's normal for me. Aside from that, I think, life growing up, I had a loving family. I was curious. I was always curious about the world around me. And I suppose that's part of what led me down this path of thinking about the afterlife and ending up as a psychologist and ending up as an IADC therapist, which we'll get into in due course. But for me, one of the early parts of me going down this path was I developed a bit of a fear of death. I remember being about 7 or 8, and I realized for the first time that everyone dies. And this was a little bit concerning to me. I was just still figuring out the world, but it made me feel really nervous. I didn't know what it meant. And one day I was talking to my grandmother. I was very, very close to my nana. And I remember this distinctly. I was 8 years old. She was putting some washing into our washing machine, and she would visit our house all the time. And her thing was she'd always do the washing to help my mum out. And I was contemplating death, and I was feeling anxious. So I said to Nana, what happens when we die? And she got this kind of look on her face like, oh, okay. And she sort of then thought about it for a moment. And then she went back to just putting the washing into the washing machine. And she said, Tommy, dear, it's just like going to sleep, but you don't wake up. And this was Nana's attempt to kind of comfort me, I suppose, to just give me a concise answer that my 8-year-old brain could accept. But it didn't really comfort me. I thought, what would that be like to go to sleep and not wake up? And it just didn't fit right for me. And I thought, well, does that mean everyone else I know is just going to go to sleep and not wake up? And what would that feel like? And it really just made me more anxious. But it started me asking more questions because I didn't intuitively feel that that was the right answer. But over time, as I got older, I would ask my parents to take me to metaphysical bookstores. And this was pre, the internet and Amazon and whatever. So I would beg my mum to drive me to a metaphysical bookstore so I could buy books and learn more. And it was this gradual kind of awakening to different ideas, different possibilities, even the idea that there is such a thing as life after death, which I have to say resonated with my soul on some level, even as a child. And it also made me open to different experiences. So I remember falling asleep as a kid and feeling energy running through my body. I remember feeling comforted, almost like having hands placed on my body, and really comforting energy going into my body as I fell asleep. I certainly wasn't one of these people, and I know you've had some guests who say, well, I was born with great intuition, or I always was so connected to the other side. I feel like I'm a regular kind of person, but eventually I developed a few experiences and a few little intuitions that were evidence for me that there is life after death. And in fact, one of those was directly relating to my nana. So as she got older, she took care of me. She was really my best friend growing up. She was just a very, very special person in my life. But as I got older, I realized our connection went beyond just a loving family connection. I would get this feeling whenever something was wrong with her. And at first, I had no idea what this meant. So, one example was I was driving home from university. I'd just started studying psychology, and I had this incredible feeling that I needed to go to Nana. And I had seen her fairly recently. She seemed fine, but it was like a it was like an itch that you have to scratch. I had to go to her. And as I arrived at Nana's house, she greeted me cheerfully as she always did. And I went inside and I thought, oh, she seems fine. What was I worried about? But when I sat down, I smelled gas. I smelled the overwhelming odor of lots of gas in the room. And she had turned on her gas burner to cook something and not lit it. And if I hadn't got there, I hate to think what would have happened. So some of these early experiences of my otherwise regular childhood really got me curious about what it all means. And a few of those intuitions were also just starting to get me attuned to this possibility that there is an afterlife, there is a spiritual world, and this is something that one day I might want to pursue.
So you were definitely open to it. And then what happened to take you on the psychology path? My guess is you've kept this afterlife and metaphysics open in your mind, and then you needed a career for sure, right?
I did. And it's actually funny, Sandra, because my spiritual thinking and beliefs were very personal to me. And I kept them kind of a little to the side. It wasn't something I would always talk to people about. And I think many of your listeners might be in the same boat. For a long time, death and the afterlife, well, it's kind of still a taboo, isn't it? It's something we don't often talk about. But I ended up in psychology because my first choice of profession didn't work out. I actually wanted to be a racing driver. And I had a deal with my parents that I was going to do my darndest to try to be a professional racing driver. But if it didn't work out, my plan B was I had to go to university and I had to study something. So this was the deal I made with my parents. And I spent a year after high school trying to find sponsorship, testing race cars, really trying to have a good go of it. And I know you've been a cook for race teams, and you've done a lot of chefing for race drivers over the years. So it's a funny connection there. But it unfortunately at the time I was devastated. My dream wasn't going to come true. I didn't become a race car driver, and that's what led me down the path of psychology. So I studied psychology. I became a clinical psychologist. And for many years, I was doing what you'd call regular psychological work. I was a therapist. I was helping people with their anxiety and depression. Always on the side, very interested in this side of us that is spiritual in nature, but keeping that kind of separate. All of that changed though when I was listening to We Don't Die radio. I was walking my dog. I was listening to your interview with Dr. Alan Botkin. And of course, Dr. Alan Botkin, many of your listeners may be aware, was the founder of Induced After Death Communication therapy. So, this amazing therapy that was derived out of what is now a standard approach to trauma called EMDR, eye movement desensitization and reprocessing. When I was doing my clinical training 20 years ago, people thought EMDR was pretty weird. Oh, you move your eyes back and forth and you feel better. And, academics would sometimes laugh at it a little bit, but it's now the gold standard therapy for post-traumatic stress disorder. It's quite amazing. Well, Alan Botkin, I heard him talking about being an early adopter of EMDR, but working with in a Veterans Administration hospital with war veterans who were experiencing trauma. But he adapted this standard EMDR protocol for dealing with grief and loss, because many of these traumas that these veterans had been through involved loss. They involved death, either combatants or their colleagues and comrades in a war zone. And so he said, well, at the heart of these traumas is loss. And he started focusing, instead of just doing aspects of the trauma that were fearful in the standard kind of EMDR way, he would focus on sadness. And he found that if he focused on sadness, the anger, the fear, the guilt, all these other peripheral emotions would just resolve. And it worked faster. It was more effective. But of course, one day he was doing this, what he called core focused EMDR with a patient. And the patient spontaneously reported that they saw the deceased person and they had this really comforting message. And this patient, who was hospitalized because their post-traumatic stress was so severe, recovered very quickly and almost to a degree that Dr. Botkin thought was impossible. So when I heard you interviewing him and I subsequently read his book and I learned more about this, I mean, at first it sounded too good to be true. But this was the first time that my twin passions of psychology and spirituality came together. And I thought, well, if this is true and it's not too good to be true and it can help people, then I simply must pursue this. And so I thank you for that opportunity to learn about that work, because it was a pivotal turning point in my life.
My absolute pleasure. It's funny. I never know who's listening. Never. And you just never know where you plant the seeds and they make a difference with someone. And I think with all of us, that's all we can do is we've got good things to share, good experiences. We just keep sharing. How long was the training? I know there's a lot to it. I know not every person can become an IADC therapist. I know you have to have a foundation of therapy. Tell us a little bit about that. And then I'd love to get into some of the experiences you've had that you can share.
Absolutely. So I did my training in EMDR solely for the purpose of hopefully becoming an IADC therapist. So the EMDR training was for people who are already registered mental health professionals. It's like I think it's a 3-day kind of long weekend intensive training to get the level 1 EMDR. So I did that. Just prior to COVID, and it was because I knew it was a prerequisite to doing IADC. And then I had to put everything on pause. I actually had this, turns out, erroneous belief that I would need to fly to the States in order to be trained in IADC. And I later learned that wasn't true, but I was kind of biding my time until I'd be able to fly and pursue this. But then actually something happened that really spurred me along and got me to kick into gear and find out that I could be trained online. I watched the movie Life with Ghosts by Stephen Berkeley, featuring Jan Holden and Alan Botkin and Graham Maxey, and the fabulous documentary that I know you've had on your show before. And when I watched this, it was like it pushed a button in me. It was like, no, I'm not going to wait any longer. If I have to fly to Chicago, I'll fly to Chicago. I'll do whatever it takes. And then and there, I emailed Alan Botkin and I said, I'm ready. Please tell me how I can be trained. He wrote back and said he had just retired, but I could train with Cesar Valdez in Michigan, who was kind of one of his IADC proteges. And so only a month or so later, I was trained. It was we did it over a couple of days from Australia. We broke it up a little bit. It's fairly intense, but then this was a certificate training allowing me to start being an IADC practitioner. So this was really the turning point. This was when I started to pursue it. I started to help people in grief using the IADC therapy protocol. Um, it's worth saying that I didn't think this was that far fetched because I had actually had after death communications of my own. And I get this really ties into the relationship with Nana because after Nana passed away, she was 84 when she died, and it was sad, but she had had a full life. And, we were so close, my Nana and I. She was really this unconditionally loving person. It didn't matter when I was young how much I stuffed up or what I did. She always just loved me and spoiled me. And so I remember thinking, if there is something out there, if there is life after death, surely I'm going to hear from my Nana. Well, months went by and there was nothing. And it made me question things. Is this actually real? But then it was 18 months to 2 years after she had died. And one morning I was coming out of sleep. It was definitely not a dream, but I saw her. And I saw her in full color, high definition. I don't know where I was. My eyes were closed, but Nana was there. And she looked about 60 years old. She was younger. She had her auburn curls, her blue eyes, and this bright red lipstick on, and she was smiling at me. And I had this absolute feeling of love wash over me. It was just one of the most healing. I still get tingles when I talk about it. I felt she was there. I knew she was there. It only lasted a moment, and when I opened my eyes and I was in bed and it was morning, there were tears soaking the pillow. I didn't realize I was crying, but it was just obviously such an emotional thing to see Nana. And I mentally said to her, "Nana, you look so good. You seem so well." And she didn't say anything back. She was just smiling. But this was an incredibly healing thing. I thought, wow, she is okay. And I knew she was okay because it wasn't a dream. I felt her presence. You know that feeling when there's someone in the room and you feel their presence. It's not a image, it's actually something happening, right?
Yes.
So that was amazing. And Nana actually, I had a couple more experiences with her at critical junctures. Things were going on in my life and she was there again. And then it happened again when my mum's dad passed away, my grandpa. Same thing, coming out of sleep, I saw him. He looked about 30 years old. Uh, and again, incredibly comforting. It wasn't a dream. And it happened a third time, Sandra. It happened when my mum's mum passed away just a few years ago at the age of 103. And I know she's just
Wow.
this incredible. My nanny had an incredible life of good health and good fortune, and I hope I got some of those genes. But again, that time was about a week after she passed away. Again, I saw her, and this time she hugged me. Some people have ADCs and they hear things or they see things. I actually felt her embrace, and she was so happy. She was like she wanted me to know she was happy and well. And again, this was just the most comforting thing. So when I started exploring induced after death communication as a therapy, I didn't need to be convinced that ADCs exist. And in fact, they're extremely common, extremely common. The most conservative estimates are that about 30% of people will have had an after death communication. And there's some research that says it's much higher than that. So I'd had this button pushed inside of me. I'd seen Life with Ghost. I knew ADCs were real. And I thought, this is part of my purpose. I need to now pursue this. So that was really the beginning of me becoming a grief therapist. And if someone had said to me, 15 years ago, "Oh, Tom, you're going to end up a grief therapist," I'd say, jump in the lake. There's no way that's going to happen. Because the truth is, I was a scaredy cat of grief. I didn't feel like I could help grieving people. I felt helpless in the face of grief. So this is a bit of a confession, really, because you think of therapists, they've always got these tools to help their clients, right? And if someone came to me with anxiety, if they came to me with depression, I had tools. But when people came to me and they were in deep grief, I felt helpless. I was willing to sit with them. I was willing to help them engage their supports. I was willing to try to help them deal with their emotions, but I didn't think I could fix anything. I couldn't make a substantive difference to their sadness. And this is the breakthrough that IADC is, because it dramatically reduces people's sadness after somebody has died. I see it as a breakthrough in psychotherapy, in fact, because part of now becoming a grief therapist, and I have other psychological work that I do, but part of what led me down this path is I wanted to contribute to the scientific acceptance of IDC therapy. It would be too easy for mainstream scientists to say, well, this sounds weird, or to be dismissive of it because it seems different. But it's very healing and very natural. In fact, I see it as an ethical obligation. You know, if a health practitioner comes across something that can help people better than anything else to date, we have a moral obligation to pursue that and to disseminate that. So I, along with my colleague John Daniels from Queensland here in Australia, and I'm a visiting research fellow at the University of Adelaide, we conducted a controlled trial of IADC therapy. I wanted to be able to put forward some research evidence with scientific credibility into hopefully what we'll publish it in a mainstream scientific journal, to help therapists realize, regardless of your beliefs about the afterlife, this is very likely to be healing for people in grief. And we have an ethical obligation to make it available to people. It's not suitable for everyone, but for those for whom it is suitable, we really need to put this to them as an option, because a lot of people can benefit. And we saw 43 people in this study. We had a 1 month control baseline period. So we measured their grief at time one. We didn't do anything for a month. We measured it again. And then we gave them these two 90-minute sessions. So the IADC therapy protocol is incredibly brief. Two 90-minute sessions is really the entirety of the intervention. And then we measured their grief symptoms and their sadness a month later. Well, what we found was that over the baseline period, their grief didn't change. We gave them these two sessions, and then their sadness and their grief symptoms were significantly lower a month later. And in fact, to put this into terms that are kind of translating this science, we talk about something called effect sizes in therapy research. It's like a degree of the strength of the impact. Well, the effect sizes, that reduction in grief symptoms, reduction in sadness, is greater than, almost 2 times greater in some cases, than your typical psychological therapies like cognitive behavior therapy for anxiety and depression. And they might be doing it in 10, 12, 20 sessions. We're doing it in 2. That's how strong this is. So the world needs to know about it.
Wow, that's incredible. And each and every one of us who has grieved the death of a loved one knows that grief is the most painful thing that we go through. I remember after my dad died, it felt like, Tom, 4 years before a dark cloud lifted from me. Even believing in the afterlife, there's still sadness that you miss the person. Now, you say the therapy's not for everybody. Can you just talk a little bit more about that? Because I know there's people that want to go see a medium. This is way different. This is focusing on healing grief and sadness, and having a loved one come through is, shall I say, like a side effect, something wonderful that happens. But the main thrust really is for grief and sadness, correct?
That's right. That's exactly right. And so we find that this does affect people in different ways than seeing a medium. Now, if people want to see mediums, that's absolutely fine. And for some people, that's going to be very healing. But I think that IADC offers something different and potentially more effective, because What we do is target the sadness and literally where that emotion is stored in the brain by having people feel their sadness. And the reason it's not suitable, perhaps, for everybody is because it can be a very intense therapy. We help reduce sadness by applying what we call bilateral stimulation. We stimulate both hemispheres of the brain alternately, and we can do that through eye movement, having somebody follow your fingers from left to right, or tapping alternately their shoulders, or the therapist can lean in and tap the person's hands alternately, left, right, left, right. This is a healing mode that our brains have. It's a very natural healing mode. And one of the theories around how it works is that when we sleep, we go through a stage called REM, rapid eye movement, where our eyes naturally dart back and forth. And this seems to be associated with processing of stored emotion, healing. It's one of the reasons why we feel better after we've slept. It's not just that we're not tired anymore, it's that our brain has done this emotional processing work. Well, we can put our brains into that healing state, that special mode while we're awake by using bilateral stimulation. And what IADC therapy does is it has people experience bilateral stimulation while they're feeling the most strong sadness that they can access. So we will say to people, what is the most sad part of this person dying? And for some people, it's a really intense traumatic memory. It might be when I got the phone call that they died, or for somebody, it might be the coffin was lowered into the ground. But also, this sadness can be really general things. I miss him, or she won't be there to see our daughter graduate, or whatever the case may be. And we require people to be willing to fully feel their emotions. We need them to be able to step into that full burn of that intensity, and then we apply this eye movement or tapping. And it's by doing that through successive sets of bilateral stimulation, might be 1 to 2 minutes at a time, we notice that the sadness gradually increases. And as Dr. Botkin says, once we start, we don't stop. If you were driving through a dark tunnel and you felt uncomfortable, you wouldn't stop your car and get out. You'd put your foot on the gas, right? And so we say to people, you got to keep your foot on the gas. The therapist does the steering, but you got to put your foot on the gas. And so it is intense. It requires a willingness to feel that intensity and an ability to really access those emotions. Now, this is challenging sometimes because, of course, grieving people spend every day managing their emotions. They got to go to work. They go to the shops. They deal with trying to function in their life. So they're used to pushing it down or managing it in some way. But when we have a client sit in front of us in IADC, we say, I don't want you to manage it. I don't want you to push it down. I want you to feel it. So it can be quite an intense therapy. And we always screen people to make sure that they're willing to fully access it. And of course, the good news is this is such a rapidly acting therapy that we see people's sadness, no matter how intense it is, even if they say it's 10 out of 10 and they're very distressed, we see eventually that sadness reducing. People start saying, I feel peaceful. I feel calm. I mean, this is incredible. I wouldn't expect with any other therapy to have a client at the start of their first appointment so distressed that it's 10 out of 10 in intensity. And at the end of the second appointment, say it's 0 or it's a 1 or I'm feeling good. And that's what we notice. That's why this is so remarkable. And the cherry on top is maybe about 3/4 of people will say they perceive the presence of their loved one in some way.
3/4 of the people.
3/4.
That's amazing. So everybody's thinking this right now, I think. Do I need to see a therapist in person, or can any of this be done via Zoom?
Well, this was precisely one of the research questions we had in our University of Adelaide study. And we did a bunch of these sessions over Zoom. We did a bunch of them in person, and we analyzed the data to see, is there any difference? And the good news is there was basically no difference. So people can tune in from anywhere in the world, literally over Zoom from the comfort of their own home, and they can expect to have a very similar level of effectiveness as if you were in the room with the therapist.
That is beyond good news. And yes, you have a moral responsibility to share this as far as you can. And I will help you as best as I can. Could you talk about some of the experiences people have? Obviously, no names, but just do they literally feel the presence? Do they get a visual sometimes, hear a voice sometimes? What kind of things could happen?
Yeah, this is the part that people are very intrigued about, and it is intriguing. It's fascinating. It's worth mentioning that if people are in that quarter where they don't have an ADC, that's not a problem. I mean, generally, our objective is to reduce sadness, and it's well over 90% of people we're reducing sadness in. Well over 90%. So if people don't have an ADC, sometimes they'll be a bit disappointed, but I try to downplay the likelihood of that, because when people are yearning for it and they're grasping for it and they're just so focused on that, it gets in the way of reducing the sadness. And I always say to people, our job number one is to help you to feel better and to feel less sad so that you can function in your life, to give you some peace and acceptance. And if we do that, we've succeeded. If you have an ADC, it's a cherry on top, it's a bonus. So we see a whole range of different experiences. It can range from quite subtle to very elaborate and intense. It can access a whole range of sensory modalities. For some people, it's visual. They'll say, I'm just seeing this scene play out in my mind's eye." I've written about 9 of these case studies in my book, if people want to read them in detail. So we go into a lot of detail, and I've got permission from those people to share their stories, and I've given them pseudonyms. But one client, who I refer to as Sheena in the book, her son had died. He had died. They thought it was probably from a drug overdose, and there are a lot of traumas that had happened in his life and her life, trying to keep him safe from drugs and crime and all sorts of things. But one of her questions, part of her sadness, was she wanted to know: Is he alone, or is he there with other people? Is he loved?" And she asked this question at the point that her sadness was already reducing. She was reporting that she felt an atmosphere change in the room. She just spontaneously said, "I'm feeling there's like an energy in the room, there's an atmosphere here." And she said, "I feel like someone's just tapped me on the leg. I feel like someone just put the hand on my shoulder." She was getting these sensory tactile phenomena, which is not unusual, doesn't happen for everyone, but that she was just reporting this. And then she asked that question, is he there with someone else? Is he loved? Does he have company where he is? And we she closed her eyes after we did some more bilateral stimulation, and she saw a vision of her son quite clearly on a grassy verge, surrounded by other people. So his best friend was there who had died, and she described that he waved his arm around as if to say, "Look, of course I'm not alone. I've got all these people with me." And she described this movement that he made. But not only that, but she, in that moment, she saw the dog who had died, the auntie who died. She said, "I'm seeing all of these people who have passed, and they're looking younger, and he's smiling at me." So, for her, this was her ADC, and it was so reassuring. It answered her question perfectly, that no, he wasn't alone, and he was loved, and he was very content, and he wanted her to know that. So we see a whole range of these experiences. I had one young lady whose grandmother had passed, and she had almost every sensory experience you can imagine. She said, I feel like I've just been hugged." She said, "I can hear her, I can smell something, I can see her." And this is not typical, but she had all these different types of ADC elements, very much in her 2 sessions. So yeah, it's quite a range of phenomena that we observe, and we don't impose any interpretation on people. I always say to people, "So what does it mean to you that you just noticed this? And in particular, how does it feel?" IDC is a very emotion driven therapy, and when people are having that experience, they say, "I feel incredible peace or incredible love, or I now feel very accepting of this." And that's part of why it's life changing. It just adds to the therapeutic effect.
No one can take those experiences away from people after they have them either. I know with dreams, there's Some crazy dreams we all have, but I know I've had some very clear dreams, say with my dad, that I wake up, I know it was real. It was like I could see him, I could hear his voice, which it's impossible for me to really recall his voice. Like I know what it sounds like, but to just hear him, I could hear him clearly. I got a hug, all that.
Mm.
No one can take that away. But to have an experience yourself and have that knowing and to be able to see or experience. I do a lot of sharing on these podcasts, and we have a lot of guests, and they all sound good. It all lends to believing in the afterlife, but there is something, Tom, to go from a belief to a knowing. So to have that experience with your loved one, you can start living your life again, knowing that they're okay.
Well, and that's what people say. They say, I was waking up every day thinking, oh gosh, I'm still here. And they didn't want to still be here. They were so struck down by their grief and sadness to then saying, I wake up and I feel ready to get on with my day. And people say you look different, you feel different, you sound different. And they'll literally say this is life changing, or I've got my life back, or I'm back to my old self. And for some people, they have been stuck in grief for, months and years. And it's almost like we've flicked a switch somehow and they can now cope much better. It doesn't remove the devastating fact that their loved one died, but that intense sadness is markedly reduced. They feel more accepting, they feel more at peace, and very often they report that they feel an ongoing sense of connection with the person. So in our research, we asked people, have you had any ADCs since your therapy sessions? And a number of people said, yes, I have, or I feel them close to me, or I've been having more dreams of them. And yeah, it's not, it seems to just open a door for some people where they have that sense of an ongoing presence and a continuing bond, which we know from grief research is really healthy for people. It helps them adapt and it helps them, be able to live and to regain their quality of life.
Is this therapy, Tom, is it specifically for someone who's lost a loved one? Or say, I know people who have been devastated by the breakup of a relationship or have been given a life-threatening disease and are going through that anticipatory grief. Can it help in other ways if someone were to meet with you?
I think it is likely to help them. It's just the difference is that when somebody is bereaved because of a death, that's where there's that ADC component, that sense of an after death communication. But I sense that the method itself is very likely to be helpful for those other things as well. And it's a great question because this is a field that warrants a lot more research. I hope that I'm not, I know Jan Holden did a study at the University of North Texas, and that's in the documentary Life with Ghosts. But I hope that it isn't just down to Jan and me. I hope there's more researchers and more people maybe seeking out grant funding and doing bigger studies because certainly the potential here is really significant.
Well, it's funny. I heard a story not too long ago about a gentleman listening to my podcast who did the research and now he's got a book and now he's helping people and he's now being interviewed by me right now. So we're going to trust that these words are going to land to more people who will continue on with this. Even some therapists who may not know that they can learn this as well and make a difference with people. I love it. How can people best find out about it? I know people can see people one-on-one. Talk a little bit about if somebody would like to book a session with you, how someone would go about doing that. Because isn't there a questionnaire that you have for people as well to make sure they're a fit?
Yeah, so I have a pre-screening set of questions on my website, healinggriefwithiadc.com. And I'm calling this my virtual private practice because it's the means through which I can reach people anywhere in the world and facilitate these sessions over Zoom. So if people go to that website, they can click on the pre-screening button and it will give them, I think it's 5 or 6 questions that will help them figure out if they're likely to be a good fit or if the therapy is likely to be a good fit for them. There's also some information about what to expect and what's involved, so they're welcome to read through that. And then if they think it is something they might like to proceed with, they can book in a screening call, which is just a 25-minute chat over Zoom, where I would ask them some specific questions. It's absolutely free of charge. There's no obligation at all, but it's just to find out if it's a good fit. And we go through that set of screening questions in about 25 minutes. And then I can answer any questions the person has, and they can figure out then if collectively we decide if it's right for them, and we can book it in. So yeah, there's quite a bit of information out there. Don't forget, Alan Botkin wrote his fabulous book, which was now 20 years ago, interestingly enough, Induced After Death Communication. It's a great book. And of course, there's 9 detailed case studies in my book, which will give people a feel for what it looks like and feels like to be in a session.
I love it. Tell us more about your book and what else we can find in it, because certainly there's got to be some spiritual lessons or something that you've gleaned from all this investigation.
There are. So it's a funny book. I think it's a bit of a cross genre thing. It's part memoir, it's part psychology, it's part spirituality. But aside from my personal journey from being this cowardly grief therapist who didn't want to deal with grief and felt helpless, to being someone who was really seeking out grieving clients, and these really amazing case studies that people have given me permission graciously to share. But there's also a lot of spiritual lessons, because when we accept it as fact that we don't die, and that there is a spiritual world, and that our bonds are not broken with death, and we're still connected to our loved ones, there are implications of that for how we live. And I spent a lot of time exploring the testimony of near death experiences and learning more about the life review. I mean, this is one of the most common features that we hear from near death experiences, is that, I saw this review of my life. But it's, of course, not just like watching a movie. They feel their interactions with other people, they feel the consequences of their influence in their life. And when people come back from that, it's just this extraordinary uh, set of contrary beliefs about what matters. Because in our physical world, we're so caught up in, status and achievement and assets and money and celebrity. We've got this whole materialist world around us that tells us this is what you should judge yourself by. Well, none of that matters a dot in the afterlife. This is the lesson. None of that matters. What matters is, did you love with your life? Were you an influence of kindness? And did you leave people better than you found them? And this is so the good news is that if anyone out there listening thinks, I want to be a spiritual person, but I don't know how. The good news is anyone can be spiritual in their life by thinking about their actions day to day and their influence on others. For me, that's what spirituality is. Sure, you can do your meditations and you can do all other things, but real spirituality is about our influence on others every day of the week. And, as soon as I heard about the life review and I read so many different accounts of it, I thought, how can I apply this now? Because, okay, I accept that I'm going to have a life review when I die, but I'm hoping that's a long way away. I can't bank on that, but we kind of, we could have this kind of karmic procrastination. Oh, well, I guess I'll face that when the time comes. But I thought, how do we remember this reality day to day? And so I started doing something I call the day review, not the life review, the day review. And I do this every day. Occasionally I fall asleep if I'm really tired before I finish this, but I do it when I get into bed, and anyone can do this. It just takes a few minutes. A day review involves thinking back on your day from the moment you got up to the moment you got into bed, and thinking about all of the main interactions you had with other people. And just thinking, did I act from a position of a loving intent? Because we know intentions matter. It's not just about how do you make someone feel, it's about your intention. It's about our influence on somebody else. And the strangest thing happened, because I didn't want to wait to the end of my life to figure out, am I living in this way that the spiritual world is going to view as, beneficial? But I started realizing there were a lot of times where I was impulsive, short-tempered, didn't really consider the other person, moments that I would be selfish, and it brought this into full view. And then doing it regularly, something strange happened. I started thinking about my day review during the day. And so I would be in the midst of an interaction with someone, and I'd have this moment where I'd think, just take a breath. Or can you word this differently? Or what does your body language say? It made me be more present with other people. It made me be more thoughtful. It made me be more kind. And that is transformative because these are the things that we know the spiritual world is going to show us at the end of our life. So why not start now and live a spiritual life in this very practical, everyday kind of way?
Absolutely. How about showing kindness to yourself? Is that part of the review?
Definitely. So, self compassion is part of being compassionate. And it's funny, in my other psychological work, I do a lot of work on the prevention of anxiety and depression. And our research in that area found that self compassion, treating yourself kindly, is one of the most protective things that you can do for your well being. It reduces your risk for anxiety and depression. And I'm absolutely certain that for people in grief, treating themselves kindly is also going to help mitigate the distress from that grief and that judgment of, why aren't I functioning at my best when I'm in grief? Why aren't I able to do X, Y, or Z? Self compassion is absolutely critical. And I had to be kind to myself when I noticed myself being impulsive and impatient. I had to say, well, hang on, I'm doing my best. And so it was a prompt for me to apply self compassion there too.
Those are good words. I know that there's thoughts in our mind that we have about ourselves that we would never voice to another person. Never. Could be arrested for some of the things we think about ourselves. Really? I mean, we're I don't know why we're so tough on ourselves. It's part of the human beingness. So I think to have that day review in catching yourself in the act. We human beings, I'm convinced we're doing the best we can with what we've got. And to spend our day thinking, "Oh, I should have done that," or having the guilt or having the fear, to catch ourselves, like, we're doing the best we can, and we're not
And if you
alone.
catch, yeah, and if you catch yourself in that moment of harsh self judgment, as I think we both have from time to time, we're both happy to fess up to that, is to now be able to say, well, if that was my dearest friend who had just said that about themselves, if that was someone I'm really close to who was judging themselves harshly and deriding themselves, what would I say to them? And what would I do that actually helps them? If we can apply that kindness to ourselves, that's self compassion in action.
Thank you for that. Tom, I happen to notice on your website you have another book, Apples for the Mind: Creating Emotional Balance, Peak Performance, and Lifelong Well-Being. Can you tell us what that is?
Sure. That book came out of my work in preventive psychology and developing a program. We call it the Healthy Minds Program, and we run that in schools around Australia. And we go into companies where we teach people the psychological skills that help you to have a healthy emotional life. And in fact, we proved that you can prevent the onset of symptoms of anxiety and depression. You can reduce risk for eating disorders, and you can do it by teaching people these psychological skills of how to have a healthy mind. And so I put a lot of that into my first book, which came out about 6 years ago. And that's kind of a personal development book talking about these psychological skills.
I'm so proud of you and the work that you've done and that you will continue to do. Oh, speaking engagements, I know you are open for interviews. Are you speaking anywhere? I believe there's an IANS, which is our friends at International Association for Near Death Studies, coming up in Chicago in 2025, correct?
There is, and I'm absolutely thrilled that I'll be presenting at the Chicago IANS conference in late August. Thrilled to have been invited to be part of a panel presentation with Professor Jan Holden and Graham Maxey, who I think you've had on your show as well, and Dr. Noel St. Germain Serre as well, who is a co executive director of IADC. So I was just really so humbled and excited when I got invited to be on that panel and present my research and be part of that discussion. So, yes, I'll be in Chicago in late August, and I can't wait.
Incredible conferences the folks at IANS puts on. IANS.org is their website. Even if you don't attend a conference, they have so many things. And if you're interested in near-death experiences, they have a treasure trove of thousands of experiences you can read, and so many things. They have chapters all over the world, and you can join these days by Zoom. Very, very good people. I know you'll really enjoy that. Tom, what else would you like to share with our time together, or is there any closing words? What do we need to hear? What else? We could go on forever.
We could. I think just a couple of things that came out from my studies and research and my own personal journey through all of this is that dying is beautiful. And that sounds like a strange thing to say, but I've read so many NDE testimonies, and that's the title of a chapter in my book. So, people often, part of the distress of grief is those questions of where are they and what happened and what did they experience. But we now have this enormous body of evidence from near death experiences, and we can collectively take all these different anecdotal accounts and regard it as scientific evidence, because if everybody's reporting this stuff, it's it's valid and it's worth paying attention to. So just the fact that dying generally is not distressing, that's not what people report. When people die suddenly, they often say, well, I left my body before the accident or whatever may have happened. And sometimes when people are resuscitated and they talk about their near death experiences, they're annoyed. They didn't necessarily want to come back because they felt so good. And so these are some really comforting lessons, really comforting realizations for people who are in grief. And so I just feel so lucky and grateful to have been directed down this path to meet you and learn about Alan Botkin and hear about all of these amazing things that so many people are doing, and to then gain these insights that have brought me a lot of comfort, and I think can bring a lot of other people comfort as well. So the good news here, there's a lot of good news. It's about the reality of life after death, the fact that we can heal grief. And we're not just healing it a little bit, people are feeling a lot better after IADC therapy. And I'm just so excited about what the future holds, because there's lots more work to be done. And certainly I'm going to keep doing it. So I really appreciate you letting me share that story with everybody. And yeah, there'll be exciting things to come, no doubt.
I'm so excited for you and for the world. I tell you, I said it before, grief, I would never wish it on anyone. It's horrible. But the more we love, the more pain there is. And so in one respect, you say, I really have a big capacity for love based on how I'm feeling. And I do think part of being human, the biggest parts are learning how to love, to forgive, and being of service to others. So we're like-minded in that way. Tom, thank you so much for being our guest today.
It's been an amazing pleasure. Thank you, Sandra.
You are most welcome, my friend. And for our listener or our viewer, thank you for taking the time to be with us. Don't forget to check out the book by Tom, Inspired Life, Beautiful Death, Healing Grief, Overcoming Fear of Death, and Living a Spiritual Life. And you can see his websites. First is tomnehmy.com, and you spell his surname Nehmy. And maybe easier to remember is Healing Grief with IADC.com. And of course, IADC stands for Induced After Death Communication. As always, you can go to my website, which is wedon'tdie.com. You can listen to past episodes, also hear my show, Shades of the Afterlife. On We Don't Die, I interview people one-on-one for probably a full hour. On Shades of the Afterlife, you can find different topics within one episode. I'm a reporter in on the afterlife. There's some interviews there as well, but there's good stuff, all at wedon'tdie.com. So in closing, my name is Sandra Champlain. I'm so happy and lucky to be your host on We Don't Die. I do believe that life is an education for the soul, and that your life here on earth is important. I really want to thank you for listening or for watching, and we'll see you again soon.